Hi, I'm Susan Taylor with Scripps Health in San Diego, California. You're pregnant, about to become a parent. Up until now, your OBGYN has been taking care of you. But once you give birth, you will need a pediatrician, a doctor who specializes in caring for your children from birth through their teenage years. This doctor is a critical partner in your baby's health. So how do you choose a pediatrician? Pick one that is right for you. Well, joining us today is Dr. Danya Lindenberg. She is a pediatrician with the Scripps Coastal Medical Center in San Diego, California. And she is a pediatrician who has a pediatrician because you're about to give birth to your what? How many children do you have?
This is my fourth.
Your fourth, because life is just not busy enough for you.
Had to add some more.
Add some more love into your life. When are you due?
I am due in 2.5 weeks, but all my kids have come a little early, so any day.
Oh my gosh. Okay, well, let's get through this interview, okay? So, obviously, you are a pediatrician, so why don't you first explain what the role of the pediatrician is?
Well, I see myself as a team member, as part of a team with you, your baby, whoever else cares for your child, in really helping to guide you in those early days, to care for your child's health needs, your emotional needs, help you guide you through breastfeeding and feeding your baby, answering any questions that may come up, really guiding you through those early days and later caring for the health of your child.
So this is not just giving shots to the baby.
No,
this is a lot more than that.
No.
So it's a physical, mental, emotional well-being, the whole gamut.
Absolutely, getting to know your family really well.
So what services does the pediatrician offer?
So we start caring for your baby if you come to us as soon as that baby leaves the hospital. And even depending on where we have privileges to come, we may even see you in the hospital. And then providing anticipatory guidance, which means guidance on common things like sleep and feeding and jaundice in those early days.
Colic.
Definitely.
The colicky baby.
Colic, all those kind of things. I always say no question is a bad question. New parents are going to have questions. Even parents who've had babies before have questions, and that's my job, answering those. And then as the baby gets older, advising about immunizations, of course, answering questions about anything parents have, but also taking care of the child. If there's any medical issues that come up, being able to diagnose and help get a child through any illnesses or challenging times in that child's life.
And so what kind of research should you do as you are getting ready to pick a pediatrician? What should you seek out?
I think any advice from very trusted friends or colleagues as to who their pediatrician is and why they like them is very helpful. Location of the practice, initially, especially in the first couple years, is critical just because you are going to be coming a lot initially. You want to find out if you get along well with that doctor, if their care philosophy, how they like to treat, what they feel about antibiotics and immunizations, how they approach you, how much time they take with you, if that meshes with how you like to be treated. Are they part of a group? Are they a solo practitioner, which is becoming less common? Do you like their colleagues? Is there generally availability for same-day appointments if you need it? Is there somewhere you can call for advice? After hours, during the day, what happens on weekends, what happens after hours in terms of care, where can you be seen or where are you directed, what kind of services they use for referrals for pediatrics. All these things are important things to consider before you choose.
So we want you to hold this thought. We're going to come back to this in a couple of minutes, and it talks about when you should set up that time to meet and greet your new pediatrician. We'll come back to that in just a few minutes. What should you consider when you're finding a doctor who fits your needs? I mean, is it gender, language, cultural considerations? What else?
I mean, first and foremost, you want to make sure they accept your insurance, because that would be a real bummer if they don't. But, you know, if you have a gender preference, absolutely important. If there's a certain language you're more comfortable in, does that practitioner feel comfortable doing the interview and the visits in that language? I
know that you speak Spanish as well?
I do. Okay. I do. I can do visits in Spanish, as can some of the others in my group, and that's very helpful for some patients.
Sure.
Other things would be, you know, some patients have certain cultural beliefs that they feel more comfortable with a practitioner of a certain cultural group, for example. Mm-hmm. That may be a little tougher to find depending on what your cultural preferences are, but sure. But also just personal the personal interaction, how you feel with that person. If you're not comfortable talking and with that person and expressing yourself and asking questions, it's not going to be a very fruitful relationship. So even if you don't meet before, which we'll get back to, I know, if it's just not feeling right for you, you're the person who has to choose to switch or choose somebody else even in that group, because you want to feel like you really have a good rapport.
And when you say you go a lot to the pediatrician early on, how often should a new parent expect to be at the pediatrician's office in the first year of life?
So in the first year, initially, we see the baby about 1 to 2 days after hospital discharge. I like to follow babies at least weekly until they're back to their birth weight, and sometimes it's more frequently depending on if they're having feeding issues or jaundice, or if parents are very anxious. Then we see them at a month, 2 months, 4 months, 6 months, 9 months, and a year. Those are the minimal. That's just the well checks. If they have any other issues, they come in more often.
Sure. And then just elaborate a little bit more about the care philosophy. What does that mean?
So, people often ask, what is your approach to how much time you take in the office, or answering questions, or what is your approach to antibiotics? Do you treat everything with antibiotic, or do you try to hold off on that and try to use other methods before using antibiotics? What are your views on immunizations? Now, you'll be hard-pressed to find a pediatrician that doesn't support immunizing children, but how do you handle it if I'm a parent who decides I want to only give one at a time? How does that office handle it? Do they discharge me as a patient because they don't agree with what I'm doing, or will they work with me on that? Are they going to treat me like a second-class citizen because I don't agree? Or are they going to just try to educate me and give me information? Does the doctor like to give out information? Does the doctor make things up to make themselves sound like they know everything, or will they admit if they don't know something and look it up? What is their sort of approach to doctoring? How do they see their role?
Sure. And what about office hours? I know when I picked my son's pediatrician, I was really happy that those folks were open on the weekends, because as a working mom, that was very important to me.
I think that is important to find out if there's, say, like late hours that will work for you, or if whenever you take your child in, you're going to have to miss work, or they're going to have to miss school. If they don't offer weekend hours, what are the alternative places they may send you? Is there at least phone triage on the weekends? Those are things that are worth asking if you are a working parent or have limited hours when you can come in. And
the services that are offered, what if your baby is sick after office hours? Because babies have this wonderful knack of getting sick at 11, 12 o'clock at night, 3 o'clock in the morning.
Right.
And what do you do? Because it can be very panicky.
It is. And I think in those cases, most practices aren't going to be open. There's always emergency, but is there someone you can talk to? Is there a physician on call at all times that you could ask something of? That's very reassuring for a parent to know that they can always speak with somebody about their child's issues.
And will the doctor and the nurse answer those medical questions over the phone, as opposed to saying, come on in?
Exactly.
Do most pediatricians do that?
Yes. I mean, the way our practice works, there's a nurse triage service, which is trained in triaging these concerns. And if they feel that a child needs to be seen, they will tell the parents that you should go in. If there's some concern that they don't feel adequately comfortable, they'll page whoever's on call. So then the physician will be able to weigh in.
And then what about a group practice? If there are several pediatricians in the same practice, can you request the same doctor each time?
We actually prefer that. We each have our own patients. I am in a group practice with Scripps. That being said, we have different schedules. So there are times when, say, if I'm not in, my patient may see one of my colleagues, or if my colleague's schedule's full, I may see their patient. And we now have these great electronic records so we can share information. But the goal is really to have one physician, because the point of this whole profession I'm in is to really get to know the family. So if they're constantly bouncing around, it's harder to get to know them. That being said, some families may have their primary and then a backup person they like if that person's not there. That's not a bad thing to have.
And what's the approximate waiting time for an appointment?
Do you mean in the office or to get in?
To get an appointment.
We always try to keep same-day appointments available.
Wow,
so they limit the number of physicals that we have, just because those are usually planned quite far out. The more popular a physician gets, or the longer they've been there. But there's always slots for same-day appointments, whether you get to see your primary, hopefully, but definitely within the practice, there should be availability generally with same-day.
And how long should you expect to be at your the appointment with your pediatrician, let's say in the first year of your child's life?
Most appointments for like a well child check for a small child, I would expect, you should not make an appointment too close to that one, because aside from the 15 to 30 minutes that the physician schedules, there's immunizations, there's getting things out of the stroller, into the stroller. So I would say leave a good hour for that visit, even though the time with the physician may be only 15 to 30 minutes.
And then how long do pediatricians recommend that you breastfeed?
So the recommendation now from many health organizations is 2 years until mutually desirable. That being said, I really try to encourage parents to do what works for their lives and for them. If they can make it through the first year with breastfeeding, that is incredible. I saw a recent study on one of my pediatric sites that most people don't even make it 6 months with exclusive nursing. Oh. Most people start nursing their babies, but don't do it exclusively for very long. So any breast milk that a baby can get is wonderful.
Because it provides what?
It provides additional nutrients, antibodies, bonding with the parent. Breast milk is definitely the best food. That being said, there are definitely cases where a mother's having trouble. It's getting in the way of her being able to bond with the baby because it's so stressful. And then it's not the best thing. So each individual case I try to assess in what is best for this family unit. And I don't invariably recommend breastfeeding above all else if it's not working for that family unit.
Do you offer breastfeeding support?
We offer some. We definitely refer out to lactation consultants. Okay. Some of our Scripps practices now have in-house lactation consultants, which we don't yet, but that would be our ultimate goal, to have that in-house. We are definitely experienced in nursing issues, inadequate transfer, tongue tie, some of these issues, but we don't have a lactation consultant in-house now, but absolutely we guide through breastfeeding and make referrals to lactation.
And what about recommending circumcision for infant boys? Is that performed in the hospital or is it done in the office?
People ask that to me a lot, and generally, insurances are going to cover both. It really depends on the person performing them. For example, I perform them and we're more set up for sure in the office. So in our practice, most of us tend to prefer to do them in the office. I am credentialed to do them in the hospital, and if there's some reason a family has to have it done there, I try to make it work, but in terms of scheduling, it's much easier for us in the office. There's pros and cons of both. In the hospital, you're being cared for by the nurses. It's done by the time you go home, but you're adding another little insult to a baby that just is learning to nurse. Whereas if you wait a week or two, the baby's presumably eating pretty well by then, a little more sturdy, and then you're doing it then. But in the end, it really depends on who's doing it and who you want to do it.
And you touched on this before, but let's just dive a little bit deeper. After you've given birth, should the pediatrician come to the hospital to see the newborn, or is it safe and okay to wait until you've actually gone home?
The baby has to be seen by a pediatrician within 24 hours and every day that the baby's there. The only thing that may change is whether it's the same pediatrician that's going to be caring for that baby. Okay. If your group has privileges at your hospital, then that group will rotate and someone from their group will come see your baby. Okay. If you decide to give birth or your OB delivers at a hospital and that pediatrician's group doesn't have privileges, the hospital will assign a pediatrician to your baby. So your baby will always see a pediatrician every day that they're in the hospital. Okay. It's just a matter of if it's the same one you're going to continue with.
And then when you get home from the hospital, how soon should you make the appointment to see your pediatrician?
We recommend making that appointment even as you know you're going to be discharged from the hospital, because we like to see babies within 1 to 2 days of hospital discharge. So the best thing is to make that appointment even before you're discharged from the hospital.
Okay. So we referenced this a few minutes ago. Let's come back to it. When should you set up a time to meet and greet your pediatrician? Should you wait until after you've given birth, or should you do it while you're still pregnant?
If you opt to do that, and not everybody does, but I love seeing people prenatally. Generally, it's before is a good time, just because by the time you have that baby, you kind of want to have chosen where you're going to be going, since it's within 1 to 2 days of discharge. Mm-hmm. Some people are comfortable taking a recommendation from a very trusted friend or colleague or family member, or they may have their children. But if you're a new parent and you like to do your due diligence, I would say a few weeks to months before you give birth is a great time. If you've done a prenatal class, sometimes you may have met a pediatrician who teaches that class and really liked them. And I've had people from my prenatal classes come do prenatal visits with me just to come talk to me. And I think that people benefit from it because you can really ask some of these questions and see if it's a good personal match.
Good fit, yeah.
Yeah, so I would say the best time is several weeks to even a couple months before having the baby.
And do you offer prenatal classes?
Scripps
or do you refer
does.
out? Okay.
No, Scripps does. Scripps
Okay.
has a whole prenatal program, and I'm one of the pediatricians on that panel at one of our hospitals to teach those classes.
Which hospital is that?
I do them at Scripps Mercy,
Scripps
but we
Mercy.
can do them at Scripps La Jolla as well.
Okay.
But Mercy is right by our office. I really enjoy teaching them. I teach maybe 3 of them a year.
What's offered at those prenatal classes?
So there's a whole series of classes that people can sign up for that can be really helpful. There's a breastfeeding class where you can learn a little bit about the basics. There's a hospital tour that they do depending on which hospital you're going to deliver at. They do a class with a prenatal educator where they teach a little bit about swaddling and various things about sleep. That can be real helpful. And then there's the class that I teach at times, which is the Meet the Pediatrician, where they get to rack our brain and ask us questions and learn some things that Scripps has set up on a formal curriculum. These can be signed up for on the Scripps.org website, and people seem to really like the series of classes.
Have you done one recently?
I did one a couple months ago. I was already expecting. I actually one time when my last child was a baby, I brought her in a little carrier to a class. My kids have come with me before.
That's an easy how-to, huh?
Yeah, I know, right? They're great because the good thing about that class is the parents get a lot of opportunity to ask questions, and they generally like that. And so every class has a different feel. People have a variety of questions, and I always try to keep it interactive. And people seem to get a lot out of it. It's really fun to have that panel, and people are, of patients who may, people who are going to be patients soon, not necessarily mine, but a pediatrician there that you can ask anything of.
Sure. It brings the anxiety level down.
It does.
Calms things down a little bit.
And people tend to get into it and ask questions,
Sure.
which is great.
Any final thoughts?
For new parents, I would say have faith that you will learn things quickly. No question is a bad question. If anyone ever makes you feel that way, they may not be the right match for you. If you have a question, almost certainly many other new parents have the same question. No question is a bad one, like I said. And just make sure you're the customer. We're there to help you, so you got to make it right for you. It's got to be a good match for you, and we're there really to help you get through this period.
Well, we wish you a speedy labor.
Thank you.
And congratulations as you enter in yet another incredibly magical time of your life.
Thank you.
Dr. Thanks so much for being with us.
Much.
If you want more information about pediatricians, please click on the link or go to scripps.org/videos. If you want more critical information about your health, we take care of you from head to toe. Please subscribe to our Scripps Health YouTube channel or follow us on social media at Scripps Health. I'm Susan Taylor. Thanks so much for joining us. It's our mission at Scripps to help you heal, enhance, even save your life.